Are you thinking about having cataract surgery, or maybe you already signed up with your surgeon? You don't know what to expect for your preoperative visit? I'm going to answer all your questions with an actual video of my mom undergoing all of it in this video, so keep watching. Hello everyone, I am Dr. Rupa Wong, board certified ophthalmologist, and on this channel we talk about eye health, eye surgery, and a little bit about my life here in Hawaii. So if any of that interests you, make sure to hit that like, subscribe, and follow along so you can get these videos as soon as I make them. So, a lot of you wanted to see parts of an eye exam, and I have some snippets of it from my mom's recent trip to her cataract surgeon, aka my husband. And so I thought it would be helpful for you to know what to expect during your preoperative cataract visit. What's going on, what decisions need to be made, what tests are being done. So during the preoperative visit, this is usually when the cataract surgeon is evaluating your cataract, doing different kinds of tests to assess what type of artificial lens to implant, and then either the surgeon or the surgical coordinator or whoever does the counseling will review with you what to expect in terms of what eye drops you need to start doing, what you need to do during the day of surgery, the morning of surgery, and what to expect after surgery. So first thing, you'll be greeted, like here in my clinic. Let's just actually, instead of me describing, let's just follow along for a second. Hello.
Hi, Dr. Rupa.
Hi guys. Okay, so I'll just take her to the back and then Melanie can do
Are you
the stuff.
vlogging?
I'm gonna vlog it. I'm gonna give this to our patients. So this is the experience, right?
Nice.
You say hello. What's it like for our patients? So typically a technician will take you back and will check your vision and ask you about the cataract. And this is where it's important, especially here in the US, because medical insurances cover the cost of cataract surgery, but you have to show that it's actually affecting your vision. A cataract simply doesn't need to be taken out because it's there. You could die with cataracts in your eyes and it's not usually going to cause a problem. So for a cataract to be removed, we want to make sure it's worth the risk of surgery, because all surgeries have risks. And for it to be worth the risk, it needs to be impacting your activities of daily living. What does that mean? It affects you being able to drive or read at night or recognize your friends across the street, or you stop doing things you like, sewing or whatever it is, because you can't see well. And that vision decrease is because of the cataract and not some other reason. So the technician will ask you for, your symptoms. What are you experiencing? Do you have glare or halos at night? Do you have trouble reading? Do you have a decrease in color saturation? Colors just don't seem as vibrant. Those are the kinds of questions that they're going to ask. Then they're going to check your vision, both with and without your glasses, and then do something called an autorefraction, which is a quick computer-generated prescription of what your glasses prescription would be. And then there's different kinds of machines for this, but what they're basically doing is calculating the power of the lens that needs to be put in the eye. Because all a cataract is a clouding of the natural lens of your eye. It's not a growth on the surface of the eye. It's the whole natural lens gets clouded. And what happens is then it obstructs light, so you can't see well out, and it can get to the point where eye doctors can't even see well in. I tell people it's like looking through a dirty windshield, and it's not like we're just cleaning it, we're actually replacing the whole windshield. So we remove the entire cataract and replace it with an artificial lens. Back in the 70s, before we had artificial lenses to implant in the eye, that's why people had cataract surgery and had really thick Coke bottle glasses. I remember my grandmother having these super thick glasses because they couldn't put the lens in the eye. You had to make up for the fact that you don't have a lens. And if you don't have any glasses, then you're gonna see blurry, because the lens of your eye is responsible for bending the light rays so that it focuses on your retina so you can see clearly. So the tests with the machine help determine what type of lens should be put in the eye. And the way that it does that, it measures how long your eyeball is. And then there's another test which measures the curvature of your cornea. Your cornea is the clear dome-shaped covering of your eye. And with these two, then calculations can be made based on the type of lens your surgeon is doing. And surgeons all have different constants. Some spend a lot of time doing their calculations, like my husband. He will spend literally, I'm not even exaggerating, 30 minutes per eye, per patient, calculating, making sure he's implanting the right power lens. Because if you're off even by 0.5, that can really affect the patient. It can really affect you and how you see. And then the last couple tests that they do is if you choose a specialty lens, and those are the lens options that get reviewed by your surgical coordinator. Well, let's just take a listen to my surgery coordinator and how she explains the options for the lens. This is a decision that usually you need to make at this preoperative visit.
We're gonna do the multifocal lens. So that lens is an extended depth of focus. So the goal is to decrease glasses as much as we can. Of course, nowadays they make the fonts on medicine bottles so small, so you may need some help with that. Lighting helps a lot too. So if you're in a dark area, they make restaurants really dark. You may need some glasses or just a little more light to help you read it. But going through your day-to-day life, you should be fine. Okay.
So that's Ronnie. She's amazing. She's my office manager. If you live in Hawaii, don't try to steal her away from me. But that's the difference between all the different lenses. So for my mom, she texted me before she came and said, I want the lens where I can read and do my computer work and do my crocheting and I don't need glasses. So that's why we chose this specific lens, which is the panoptix. I say we, I didn't choose it. Well, I guess I did, but my husband's the one that really chose it because he chose the power. Now, when you have a premium lens like this, and they're all different types of premium lens options. Panoptix is made by a particular company. There's other premium lens options which do similar types of things in allowing you to see different ranges without needing glasses. We really want to make sure you're a good candidate. We want to make sure that the inside of the eye is healthy, that your eyes are not dry, that you're going to have very, very good uncorrected vision with this lens in your eye. So for that reason, then we do a couple additional tests that we don't necessarily do for people who are choosing the standard lens. And the standard lens is a fantastic option as well. This is what I implant in children. It's very tried and true, and it's going to give you excellent distance vision. But it means you're going to need glasses usually for computer work and for reading. So the additional tests includes an optical coherence tomography, an ultrasound of your retina, so we can assess that there is no macular degeneration or little fluid buildup, nothing that's going to impact your postoperative quality of vision. And then the other test is called a corneal topography. And since my husband's a cornea specialist, we have a topography here in our office, and that's this test right here. So what that does is it measures the cornea and makes sure there's no irregular astigmatism, and it also tells us if there's some astigmatism and we need to change the type of lens, because you can actually get these lenses to take care of your astigmatism too. So that's typically what happens during your preoperative visit. In addition, the surgical counselor is going to review with you your eye drops and what you need to do. Usually you need to start antibiotic drops, a steroid drop, and a non-steroidal eye drop 1 day before surgery. Previously, we used to start them 3 days before surgery, but most of the studies have shown that 1 day before surgery is fine because we inject antibiotics and anti-inflammatory injections at the time of surgery as well. So these drops can be 3 separate bottles prescribed by your eye doctor, or it can be an all-in-one eye drop, like here. Now, at this preoperative visit, they'll tell you that you need to remember to stop eating after midnight, the night before your surgery, and really no water either, except small sips of water that you take with your medicine. But the nice thing about this cataract surgery nowadays is it's very bloodless. So you don't need to stop blood thinners if you're on Coumadin or heparin or warfarin. You keep taking those things. You don't need to stop taking your Advil or your Motrin. You can continue all those medicines, which we used to have to stop when cataract surgery used to be more invasive 20, 30 years ago. And then we just like to remind patients, don't wear eye makeup on the day of surgery. You'd be surprised. guys. And if you wear lash extensions, I would not get a fill right before your surgery because the way that we put the drapes on during surgery can actually rip your lashes off and you would not be happy. It doesn't rip your natural lashes, but it can take some of those extensions with you. So it's not something my husband says he ever talks about, but I, as a woman who used to be a lash extension addict, I would tell you that. So there you go. So that's everything with a preoperative visit. If you're interested, I'm also got coming up what a day of cataract surgery actually is like from a patient perspective, again, my mother, and then what to expect post-operatively. So keep a lookout for those videos. Make sure to subscribe. If you have any questions, drop them in the comments below. If you've had cataract surgery, had a fantastic or maybe not so fantastic result, I'd love to hear. Drop that in the comment below as well. And until next time, I'm Dr. Rupa. It was good to see you. Bye for now.